So I'm excited now to share with you the results of our recent survey on sentiments about diabetes technology and diabetes education among people of color. Special thanks to this amazing group of advocates, some of who are here with us today to conduct a panel discussion following this presentation. That includes Ariel Lawrence, Quisha Mimba, Joyce Manalo, Kyle Banks, and Mila Clark-Buckley. Also thanks to Sharice Shockley and to this additional group of advocates who helped with the video that you just saw and who helped to compile and to vet this survey. So we conducted the survey online in September of 2020 through a community tree recruiting model, meaning that we worked with a group of advocates who in turn each recruited additional folks from their community and so on, and also through a number of established online networks. Of course, this was a convenience sample, not statistically significant, but helping to provide a powerful snapshot of sentiments among people of color with diabetes who are active online. So you had to be age 15 at least and have diabetes or care for someone who does to participate. And you also had to identify as a member of the community of persons of color. So we had 207 respondents in total. The vast majority of those people were insulin users. And among that 91%, 9% were caregivers who are overseeing someone taking insulin. The large majority were female respondents. And in terms of how they identify as persons of color, 42% plus were identified as Black or African American, 30% plus Hispanic or Latino, almost 14% Indian, South Asian, or Middle Eastern, 10% Asian, and the other category included Indigenous peoples, American Indians, and so on. We asked about, as a baseline, about their diabetes care and their technology use. So we asked people pre-COVID, where did you get primarily your diabetes care? 80% said they see an endocrinologist, 22% said they're seeing a primary care physician, and this, again, pre-COVID, was only 8.5% people relying on telemedicine and 5% on community clinics. In terms of use of diabetes technology, 71% are using pumps, 80% are on continuous glucose monitors, a pretty good proportion are using some sort of smartphone app in their diabetes care or an insulin pen. And altogether, only 7% of people said that they either know about the tools and don't use them or didn't know about the tools at all. So we used a mix of quantitative and qualitative questions to probe into people's healthcare experiences, their access and experience with diabetes technology in particular, whether they felt represented in this community, and what they think might differ about their care versus that received by someone who is white. In terms of healthcare experiences, we asked people to basically rank their most prominent feelings about their interactions with healthcare providers over their diabetes journey on a scale of 1 to 10. And the most prominent answers, meaning scored 1 to 3, actually came out mostly positive. So over 65% said they feel respected, 59+% feel listened to, 36.7% feel comfortable asking questions. And as their most prominent answer, only 17+% said they feel talked down to, or felt stereotypes were at play, or felt disrespected. But interestingly, when you dig into the written responses, you see a little bit of a different story emerge. So we asked people about their worst experiences, and this was a write-in question. And the most prominent things that were mentioned, most commonly mentioned, were among insulin users, lack of empathy among healthcare providers, those providers not being well informed enough, a lot of discussion about misdiagnosis, and also insurance barriers, and upgrading to new technologies and running into snags. Among those not using insulin, a good 30% of the comments were talking about lack of knowledge among their doctors about new diabetes technology. When we asked people about their biggest challenges, we found that a lot of people, of course, mentioned diabetes technology being out of reach because it's just so expensive, but they also talked about things related to race. So things like trying to accept this disease and the feeling of loneliness since my race is not represented at all, or being stereotyped as not taking care of my diabetes since some endos just don't understand the parameters of my life, etc. Worst experiences were also often things like being sort of left on your own after diagnosis, just basically being told you have diabetes and left alone to kind of flail and figure it out on their own, or feeling stigmatized by their healthcare team. We asked a little bit about access to diabetes technology. In the first place, where did they primarily get their information that helped them make decisions about diabetes technology? 45% said they rely on their endocrinologist, and 14% said they rely on the online community of patients. And these two answers actually dwarfed all the other options that they were given, including things like print materials and a diabetes educator, etc. We also asked, if you do use technology, have you had any issues that disrupted that use? 44% said yes. And the most common things were insurance and costs, device malfunctions, and a lack of communication between medical suppliers and doctors. Then getting to the heart of the matter, we asked people point blank, when you see commercials or websites for diabetes devices or treatments, do you feel represented? And a good half of our respondents said not at all. So 51% of all, 51% of insulin users and 54% of non-insulin users said they simply do not feel represented at all. We also asked people, has a diabetes company ever reached out to you to ask you to be part of a team, a committee, or a study? And we were a bit surprised that 22% said yes, but when we asked them about perceived intention, 41% said they were generally concerned. They felt that the company was generally concerned about them and their community. 27% felt more like it was for show or making a quota. And then a full 30% of these people said other. And we believe that's because they wanted to explain themselves. And we got a lot of write-in answers. And among those, we got sort of a mixed bag. So we got things like, yes, I've served on many focus groups related to type 1 diabetes, technology, medication, and I'm thankful that they value my opinion. Others said they did not ask questions about race and were uncomfortable when I brought it up. I assume they thought I was white. We had a number of people mentioning that if they could pass for being white, that created some tension and some problems for them. We also asked, just put it out there, what do you think is different, if anything, about how you as a person of color receive diabetes care and education versus someone who is white? And culling the trends from the comments, we found the most prominent things people said were, there's a lack of understanding among doctors about patient experiences when you're a person of color. There's a lack of education, information, and in particular, mental health resources. There's not enough clarity about the different types of diabetes and diagnosis. And again, going back to lack of representation in ads and in marketing materials. So a couple of standout comments here. People said things like, medical providers may not even be aware of the disparities, such as work schedules and access to reliable transportation, that create challenges for people of color compared to professional white workers. Another person said, growing up, I noticed a distinct lack of representation in diabetes education materials. And someone else said, I just need to see people who are using the products that represent a diverse population. So overall, the trends we observed were that a lot of the concerns were the same as sort of the general population with diabetes. So we've conducted similar studies over the years with a broader group of respondents who are predominantly white, and they also talked a lot about grappling with access and cost barriers. They talked a lot about desperately seeking healthcare providers who are informed and empathetic. So those are universal. But what was different among this group of people of color is that they generally don't feel represented in marketing efforts and in education materials, that misdiagnosis seems to be highly common and is not explored enough. And they felt doctors don't understand their experiences and what's unique to their culture. So now I'm excited to bring up this group of advocates to have a conversation about these topics. This session will be led by Ariel Lawrence. Ariel is by day a project manager at a public health nonprofit in New York City. She's had type 1 diabetes for 14 years, and she is the creator of Just a Little Sugar, a personal blog that seeks to shed light on the experiences of individuals of color affected by diabetes. She previously presented at the American Association of Diabetes Educators Conference, and she has also conceived and executed several events on her own, community events, including Diabetics on the Margin in partnership with the Beyond Type 1 community, and another event called Invisible Identities, a conversation on disability and diabetes. Let's welcome Ariel.